Hello, this is Dr. Steele. Today I want to talk to you about a subject that is extremely important to remember. I don't care how old you are, we all are at risk for infections. But infections sometimes can be treated because it doesn't go anywhere. It can be a skin infection, a lung infection, a urinary tract infection, different places, different locations. However, when we have something called sepsis, that means that the infection, the bacteria, has evolved to the point that has invaded your vessels. And if it invades your vessels, that can create a circulatory collapse if we let it linger. So we need to remember the signs and symptoms of somebody with sepsis. So somebody with sepsis, the main thing that we need to always remember is going to have shivering, fever, or they're going to feel very cold. But fever and chills, remember that fever and chills, and you cannot stop shaking, that could be sepsis. And if that happens, you cannot wait until Monday because of for some reason a lot of things happen on the weekends and during holidays. You need to go seek medical attention right away. If your fever, chills, and another one is extreme pain or general discomfort. Worst ever, you feel run down, you don't feel good, you feel like something is really off. Fever and chills, a feeling of discomfort. And of course, some people, especially older people, they can feel, you can look pale, like you can look, their skin looks discolored. Something's really off. Another sign and symptoms that I want you to remember is sleeping difficulties. They're very sleepy, they're very, confused. That's something in medicine called altered mental status, that their brain is not working right. That could be a sign of sepsis. Even though the temperature may not be high, but they're acting goofy. Our patients, meaning, or your mom or your dad. We need to seek medical attention right away. Another one, they may feel like uh, I might die. They feel like very discomfort, like I'm dying. Something's really off. And lastly, shortness of breath. Because when you have sepsis, your heart is trying to compensate for those vessels that are being damaged. And sometimes when that happens, those vessels dilate. And when they dilate, they make you feel that you need to breathe more to counteract the dilation of those vessels. And I'm doing that on purpose because the main thing is the patients cannot speak to you fluently. They speak to you in pauses. That could be a sign of shortness of breath. So my talk for today is it's very important to recognize those signs and symptoms because we want to prevent our relatives and our children and everybody around us from dying from this. When now in this day of this time, we can actually provide treatment for it. But don't delay. The final thing that I want you to remember is an analogy. It's like a house that is burning. There's a fire in the garage, and then your husband or your wife is not going to say, "Well, let's wait until Monday to see how everything looks." No, no, no. You're going to call the fire department to take care of that as soon as possible. The same thing with sepsis. But the main thing is fever and chills, acting goofy, feeling run down. Something's off. The patient looks sick in your eyes. They're not acting, you know, as they used to. So keep that in mind. So that's my talk for today. Seek medical attention. Don't wait until Monday.